Hi, my name is Robbie, and I'm a health educator here at the Montrose Center. We're beginning a new series called Ask an Educator, where we're going to be researching topics of interest on sexual health submitted by you. If you're interested in us researching topics of interest, feel free to email us at info@montrosecenter.org or feel free to comment below. Today's topic of conversation is antibiotic-resistant gonorrhea. This is not something new, but it has gotten more attention in the news when the World Health Organization released some more information about increasing resistance. Gonorrhea is caused by the bacterium Neisseria gonorrhoeae and can be transmitted through oral, vaginal, and anal sex. This can in turn increase infections of the throat, the rectum, and the genitals. It's very possible to experience no symptoms of gonorrhea. 40% of men, as well as 80% of women, report having no symptoms at all. If we do have symptoms, those can include having some burning and painful sensations, especially during urination, bleeding between periods, discharge from the genitals, and then less likely to occur is going to be some swelling of the testicles. We can simply get gonorrhea treated with some antibiotics. Gonorrhea is a very common infection. In 2015, there were reported 395,000 cases, but it's estimated that there are over 820,000 cases of gonorrhea each year. We see resistance develop for many reasons. First off, increasing unprotected oral sex is being practiced because of the incorrect assumption that it's a safer type of sex. As a result, this has in turn increased infections of the throat by STIs like gonorrhea. Improper use of antibiotics contribute to drug resistance as well. For example, when being treated for an STI, people may stop treatment once they've noticed that symptoms have cleared up. It's possible then to assume that we've been cured when in reality we may still have this infection. The parts of the infection not killed off during the use of antibiotics can become stronger and are less likely to be cured with additional medication. Other factors that contribute to resistance include the availability to testing as well as the overuse of antibiotics. Government and health organizations have a role to play in increasing the development of new medications, increasing the availability of testing, as well as providing greater access to treatment. But what can we do to aid in the prevention of gonorrhea? First, it's recommended that people diagnosed with gonorrhea abstain from sex until they have completed treatment. This can help to prevent future transmissions. As I've mentioned earlier, oral sex is increasingly being practiced. We want to make sure that we are utilizing barrier methods to keep ourselves as well as our partners safe. We can use dental dams and flavored condoms to reduce risk of infection. Testing can also be a good method to prevent infection. We want to make sure to get tested at least once a year. If we are more sexually active, we should get tested more often. We may also want to consider getting tested with our partners. If ever we do need treatment for something like gonorrhea, be sure to complete treatment and maintain care under the supervision of your doctor. Having open and non-judgmental conversations with our friends and family about things like gonorrhea can help in the prevention of gonorrhea and other STIs. Thanks for tuning in to this segment of Ask an Educator. If you're interested in submitting an inquiry for us to research, please feel free to email us at info@montrosecenter.org. Remember to include in the subject line, Ask an Educator, or feel free to comment below. Stay healthy, Houston.